Hey guys, it's your old buddy, old pal, Emma, viggling with TYT Politics. I hope everyone's having a good day, despite the fact that the GOP has tried to rebrand their new healthcare bill as something a little bit better. It does improve in some tiny areas, but the bulk of the bill is still disastrous, and it regresses in a significant way. I want to talk about that and the major overarching changes in that bill, and also talk about how, while that's happening, Medicare for All is gaining traction amongst regular Americans, while in Washington they're talking about how they can make our coverage worse. So we are living in some sort of alternate reality, except we have to actually feel the effects of it, so it's horrific. So again, they introduced their revised bill today. The bill keeps in place the deep cuts to Medicaid and the elimination of the current mandate to require people to purchase insurance. It would keep most of the Affordable Care Act's taxes increases, so that's like one of the good things, because the Affordable Care Act did have a lot of tax increases on wealthy Americans, so they were kind of pressured into that, I guess, by the more moderate Republicans. But Repeal's one specifically aimed at the medical device manufacturers, who behind the scenes have a ton of influence in Washington. If you read and watched Jonathan Larson at TYT Politics' piece on Stryker, so go check that out if you're interested. Maybe the biggest change in this bill is that the revision in the amendment to allow health insurers to deny coverage based on pre-existing conditions and cover few benefits. So you're born with a disease, you can't help it, you're not as fit biologically, so the health insurers have a Darwinian right to deny you coverage. That's really what they're saying. It's dog eat dog in the Republican Party, and they want America to live that way. So yes, now under this bill, health insurers can deny you coverage based on pre-existing conditions. It was already sort of that way before, but it added a specific amendment to do so in this new bill. Experts expect the changes will do little to change the CBO's estimate that 22 million Americans will lose coverage under the proposal. Vox further explains, healthier and higher income Americans would benefit from the changes in the new Republican plan, while low income and sick Americans would be disadvantaged. That's who we need to protect, healthy and high income Americans. It's so obvious who they work for. It's so obvious that it's not people. It would create a two-track system for health coverage on the individual market. One would offer cheaper, deregulated healthcare plans, which healthy people would likely flock to. So, if you're healthy, you'll continue to have these benefits. The other would include comprehensive plans governed by Obamacare's regulations, which would cost more and most likely be used by less healthy people and those with pre-existing conditions, a system experts expect would function like a poorly funded high-risk pool. So we're back to the high-risk pools. So there are few changes in this new bill, but you guys already know what was in that other bill. And did you really expect this to be much better? Let's hope that this rebranding effort by Mitch McConnell, actually doesn't work, and the moderates still stand against it, and the libertarians like Mike Lee and Rand Paul also do so, because it's not draconian enough for them, but we shall see. What I find interesting is this extreme irony that while this bill is being discussed as a viable option, Medicare for All and single payer is becoming extremely popular in the country rapidly. So Jeff Merkley on Tuesday, the senator from Oregon, the other senator from Oregon, Ron Wyden, Jeff Merkley, they're both, pretty good Democrats in my opinion. He said on CNN, what I'm hearing, even in these conservative parts of my state that I lost by 30–40% when I was running for re-election, what I'm hearing is the system is way too stressful. He said, I've been asking each audience, I've been saying, how many people here 10 years ago would have supported a single-payer Medicare for all? And it's a small number. And then I ask, how many now? And the hands go up throughout the room. Majority Leader Mitch McConnell said on Tuesday that single-payer health care plans similar to the one championed by Senator Bernie Sanders during his presidential campaign would strip Americans of so many facets of decision-making over their own health care and hand it to the government. Again, decision-making is the most ridiculously rebranded word by the Republican Party. They basically say that if you want to be helped, you are being stripped of all of your freedom. So it's an old talking point, and I don't think it's working, because this isn't just anecdotal from Senator Merkley. Pew Research study in June said 33% of poll respondents said they favored a single-payer system. So they knew what single-payer was. 33% said they favored it. This was from Pew, in which the government covers medical expenses with tax money over the current system based on private insurance companies. So 33% favor single-payer over private insurance. That was an increase of 5 points since January and 12 points since the end of 2015, December. That's a ton of time in a year and a half. 12 points. That's because Bernie Sanders, honestly, is introducing it into the conversation. Hillary Clinton said it will never happen. Now you have Merkley talking about it. You know what? It's eventually going to happen. I'm telling you guys. It's gonna. The American people are behind it, and now you're slowly getting Democrats behind it. And by the way, let's look at another poll where they specifically talk about Medicare for all, because polling is so significant how you phrase things. Because if you say single payer, a lot of people don't know what that is. But if you say Medicare for all, which is really the same thing, there's a much more positive response, because Medicare is a really popular program in America. So when The Economist / YouGov polled and talked about Medicare for all specifically, 36% favor strongly, 24% favor somewhat. So let me do the math for you. 36 plus 24. I don't want to do math on camera. I just realized that. But you'll look at the numbers for opposition. Oppose somewhat, 10%. Oppose strongly, 13%. So that's, I'll do math right there. 23%, good job, Emma, that oppose, and 17% are not sure. So let's just say favor strongly, favor somewhat. People see this as favorable. I know it's 60%, I know. I mean, I just wasn't sure at that moment. Math on the fly is not my strong suit, guys. Please forgive me. So the other senators championing this bill, obviously Bernie Sanders. Merkley actually hasn't said outright that he supports this bill, but he did say healthcare should be a human right. And based on these comments on CNN, I would assume that he does. But again, Democrats can be ridiculous, so we shall see. But Elizabeth Warren has been increasingly vocal on this issue. In the past few months, no one has been more vocal besides Bernie Sanders, in my opinion. And a very surprising ally that we got on the left in the Democratic Party is Kirsten Gillibrand, who really wants to run in 2020. She gets a ton of money from corporate donors, and I'm really pleased and surprised that she's been on board for single payer. So great news, all the credit for her, really happy. I hope she backs it up with a vote, but she's said it publicly, so, you know, all the credit in the world. Tammy Baldwin, senator from Wisconsin, who faces a tough re-election in the state, won by President Trump, says she's a maybe on Sanders' plan, but anticipates supporting it. Okay. But look, progress. Bernie was the only person talking about this months ago. And the polling is trending so rapidly in the direction of Medicare for all. And let's not forget the House. So John Conyers has been introducing this legislation for years now, and now he's really gotten a ton of co-sponsors based on a lot of, by the way, online pressure by groups like Justice Democrats and like TYT. Tulsi Gabbard did not endorse those past parts of the bill and only joined on now. You can look at the timestamps on that. I know I've gotten backlash, but it's been confirmed. She was not on board for the bill. Now she's a co-sponsor. They have 113 co-sponsors in the House. Key names that are absent from the list include House Minority Leader Nancy Pelosi, Minority Whip Steny Hoyer, okay, so Nancy Pelosi not on board despite being vocal about single payer in the past. Now she's saying that she has Michael Jordan-esque leadership. Who said that? Oh, God, it was someone in the House that compared her to Michael Jordan. Michael Jordan won things? Oh. Okay. But in the House, again, they have nearly the double of co-sponsors. for the legislation than garnered in the last congressional session. So double now, 113, which is fantastic progress. But I guess I hear the Democrats are the same as Republicans. Okay. Some of the leadership, Democratic Caucus Chairman Joseph Crowley and Assistant Democratic Leader James Clyburn, also co-sponsors of the bill in the House. So, it's a process. It is far too slow of a process. But look, things are turning. Wheels are turning. Things are happening. If we have a progressive Senate, House, or even if we had a Democratic House and Senate and a president that was like repeat Obama in 2008, if the polling was as it is now, I feel like we could get it through. If the political engagement is what it is now, I feel like we could get it through. So we just have to keep public pressure. So as the Republicans decide to ignore the entire damn country and where it is trending and strip coverage from millions of people, tens of millions of people, and also, by the way, their bill in its incarnation is extremely unpopular. So it's not just single payer and Medicare for All's popularity. It's their own bill being like toilet paper. It's ridiculous. Not even worth toilet paper. They will go against the people, and with this level of political engagement, we will really start to see a bigger push for single payer. Healthcare has been a fight for decades now, and it's all culminating to this one point. And we are seeing even Democrats like Kirsten Gillibrand getting on board. So things are coming along. I am hopeful that this bill doesn't pass the Senate. It may. We can't let our guard down. I wasn't sure that it would pass the House, their incarnation of the bill, and it did by a hair. So keep your guard up, but also know that the tidal wave of populism behind single payer is coming around the bend. It all really started with Bernie Sanders saying it was possible, and now senators and double the amount of Democrats in the House are on board. And the polling is pulling that. So, call me crazy for being optimistic. That's okay. But when it gets done, I'll be smiling, and I won't rub it in your face because I'll be so happy. Have a good day, guys.